Do you know what your child may be abusing? The state conducted its first survey across Tennessee asking students about using drugs and cigarettes.
News Channel 5's Matthew Torres with the first look at the results.
Parents should realize that engaging earlier is better than later because they may have already been exposed.
The state now urging parents to act early on. When it comes to drugs, cigarettes, and alcohol, younger kids are getting exposed. And it seems many parents aren't sending a warning.
If we're seeing an age initiation of 13 in some areas or 14 for other substances, you need to talk to youth before the age of 13. Preferably 10 or even before then.
Director of Prevention Tony Jackson says it's as young as 11 years old in one county. That's the reality based on the state's first Tennessee Together student survey. More than 21,000 middle and high school students in 28 counties answered questions about prescription drug misuse and marijuana and cigarette use.
It allows us to have a baseline to operate off of, to see if what we're doing is working, if what we're doing is impacting communities across the state.
We have really high rates of e-cigarette use among our youth population.
The survey showed 1 in 3 students smoke cigarettes or e-cigarettes, almost a quarter of them within the last 30 days. When it comes to marijuana, it's 1 in 5 students. More than half didn't see it having a great risk.
So perceived risk, how much you think it harms somebody to experiment with these things, has been shown to be linked with kids' decisions whether or not they're going to use.
Researcher Lacey Hardigan says when it comes to prescription drugs, the perceived risk is a lot higher to more than 2/3.
Our prescription drug misuse rates were about 1 in 10 students reported ever misusing, which I think was a little bit lower than we were expecting.
The survey may be exposing trends, but it's opening up opportunities to target where help is needed most. Matthew Torres, News Channel 5.